Good day, my name is Jeremiah de Guzman, your student nurse for today. And to start, may I know what your full name is?
I smile at all of you.
And how would you like me to address you?
Mariel,
Okay, so Miss Maria, just for verification purposes, may I know when is your birthday?
September 20, 2015.
So today, I'm going to be assessing your mouth. And since it involves body fluids, as I'm going to check inside of you, I am going to wear sterile gloves, but don't worry. The reason why I am wearing gloves is not because I have skin abrasions, and lesions or cuts or whatever. I'm doing this for your protection and for both of us protection, as this prevents rather contamination and sickness. If that's okay with you.
Yes, it's okay.
This will all take a while. I'm going to wear the gloves.
Now that I've gotten the patient's consent, I am now preparing and wearing the gloves, but firstly I am going to check the package of the gloves, check the expiration date, and checking if the size is correct. Once I got all the information correct, I also make sure that the package doesn't have any damages or any tears. After ensuring all the correct information in the package is not damaged, I can now tear the seal off. After completely removing or tearing the seal, I do take note that it is important to perform hand rubbing to maintain being sterile. As I open the gloves, I do only touch the edge of it to limit touching the sterile part. And as I hand rub, I dry my hands thoroughly so that I can wear the gloves with ease. When wearing not the gloves, I pinch my non-dominant hand towards the folded part of the glove, as this is only acceptable touching from the bare hand following the non-sterile to non-sterile or sterile to sterile contact. I do find it hard to wear the gloves, however, patience will be needed, especially if you're a beginner, because you can only touch the unsterile part only. Once I have worn the gloves, I left it fully unrolled because later I can adjust it to fit. Now that my right glove is fully worn, I slip the sterile part of the glove into the other glove, touching the anterior part. Once my right hand is placed, I now insert my left hand, aided by the right hand. Once I have worn the glove, it doesn't matter if it is fully worn because I can now adjust the gloves to fit my hands. This is acceptable because I do follow the rule of sterile to sterile contact as I avoid sterile to non-sterile contact. And after adjustments from the left and the right gloves, I can now perform a procedure that is needed. Prior to performing a procedure, I do take note of any damages or any tears from the gloves. So this is to avoid infection and protect myself from any hazardous material. So you can see right now, I am checking both left and right and the front part and the back part of my gloves. In disposing the gloves, the sterile part now is my bare hands. So as I grasp the unsterile part, which is now the gloves, I avoid touching my wrist. Once it is removed, I place it to my other hand to crumple it, and then I use 2 to 3 fingers to slip inside my gloves to remove it. And as I remove, I discard it to yellow bin. And lastly, hand hygiene is still extremely important to do.